I'm David Mason, the Director of Public Health for the town of Sandwich. We're doing PSA number 10, second year. Just a quick outline, what we're going to go over today. We'll talk about, Chief Burke and I will talk about Governor Baker's rescinding of the social distancing protocols, the removal of the state of emergency on June 15th, vaccination status, and testing. And as usual, we'll go to Chief Burke for an update of where we stand in the town with cases at this time.
All right, thank you, Dave. Good afternoon, everybody. Happy to report there are only 4 active cases in town today, 7 hospitalizations, 3 in the ICU. So we made it under that double-digit threshold. Our color code should be transitioning, if it hasn't already.
Probably tomorrow.
Probably tomorrow. So that's good news. I think, again, the amount of, and I believe we're the most vaccinated state, or one of the most, is paying dividends now. I think we're seeing that now with the low case count.
As far as, well, let's jump to the vaccination status. Last week, the clinic was held at the Human Services Building with Joanne Gake, the public health nurse, and with the help of Pam Gould. You want to talk about that? We did that last Thursday for 12 years and up.
Yep, 12 years and up. Approximately 200, a little north of 200 came through for shot 1. We have to thank Ben and Jerry's Ice Cream. They did provide some sweet treats for people as they exited. So that's a good showing. Their second shot will be June 11th. Similar setup. Again, the afternoon seems to work. And again, that's good. And I think we ramp up for, I know there are some people on the fence with the vaccine, especially for the 12 and up age group. So we're already looking at, what does late July, early August look like for another clinic just prior to school beginning to get kids squared away. And it could also be for those that are heading back to colleges and universities. Yeah. So we're always planning ahead. We're always prepping, and that's kind of where we sit right now with vaccines. Joanne still has a small amount. I think anybody that's wanted a vaccine has received it. But again, if there are questions, you can call the town nurse and schedule a vaccination. It was interesting. We just had a new hire that was away and at his previous department, and he, was struggling to get a vaccination and was able to get it right away with us. And I think it was more of a timing thing, but we were able to get him vaccinated and other new employees. And I think having the town nurse, again, shows the real value of what Joanne can do for us, for the town and for municipal departments.
Exactly. It's a huge benefit having that and what's been established over the years, and for her to carry it forward. It's worked out very well this past year.
Yes.
Just on the vaccination clinic last week with the 12-year-olds, we actually, you speak to the fact that you have some people changing their mind. We actually had 3 adults jump in, parents along the way.
Perfect. Yep.
That asked, hey, can I jump in here? So we took advantage of that. And I was rather amazed at the number of 18-year-olds that came through on their own. They're adults. Yep. But I don't know at 18 whether I would drag myself there. But a lot of them were athletes and talking about competing in college next year and the need for it. So they wanted to get it done and over with. Which speaks to them and the probably need, and speaks further to your suggestion of an additional clinic as we go through the summer.
And I think making it easy, and I think that site has been huge for us, not only this year, but in years past. But again, doing the public safety folks January, February kind of set the table. Joanne did multiple clinics up until the last week or so, and then we transitioned to the pediatric. And I think the site works well. I think traffic and coordination amongst multiple agencies works well, and it puts us in a good position. Because again, we're going to be looking at the fall, not necessarily COVID boosters maybe, but you're also looking at flu shots again, and we have that template ready to go.
Very good. Just as we're talking about vaccination, just one thing to remind people on too is they're talking about that second booster. This may become a regular thing. Just because currently people, when they receive the flu shots, they're actually receiving a dose of the H1N1 when the swine flu came through. That is incorporated in the flu dose every year. So so that's something that's been ongoing. And we may see this type of thing also, that it kind of just merges into a regular flu shot routine as far as to maintain vaccination against the virus.
And I think an interesting point, Dave, is the need for a booster. And what's the trigger for that? Is it a time frame thing? It is. We're doing some behind the scenes work with a unnamed company right now on the ability to put a number, a threshold as to if you're below a number of antibodies, you would need it. If you're above, you wouldn't necessarily need it. I think that's important for people to be able to make their own decisions based on that. So we'll have more information on that in the next coming months. But it's one of the things that right now we do antibody testing and we just see what the levels are. I did mine again last night. Still have a strong IgG response. But it doesn't give you a number. It doesn't give you a full picture.
Right.
And again, I think that's the direction we're headed now, is to, do you need a booster, and what's the triggering point for that?
So nationally, we'll see more of that.
I think that's going to be the next play as we move forward.
You want to continue on into testing, what you've set up?
So with testing, we worked with the Chamber of Commerce, and we came up with a pretty cool acronym called Project Beat COVID. Business Employment Assistant Testing is what the BEAT stands for. So the businesses in town, if they have somebody that is symptomatic or they have somebody that was positive and other workers were exposed, it's routed through the chamber to you and I to make a determination on the level of testing needed, and then we can go either mobile to their site or set up appointments. I will tell you, we have already done 3 businesses that have asked for assistance already that we have scheduled. And one of them, we were able to find a positive person, which is important, which then sets the contact tracing in motion, and we're able to get ahead of something pretty early. So it does work, and we're more than happy to offer it to our business partners. And speaking with the chamber last Friday, it's just good that they have something in their back pocket they can utilize, because good luck finding testing right now. And we went through this ebb and flow of, it fluctuates with vaccines and testing goes down, but honestly, take a look at what testing is available compared to vaccinations. And again, we want to keep that posture still in play as we move forward, and we're doing that, and we're roping in the business community to keep them operational for the summer. It's going to be probably nuts down here, so we want them to keep their businesses open and functioning.
Because it's still here, and that's a good transition from that testing, that program, working with the business community and offering that into what Governor Baker has just done as far as his announcement for the removal of the COVID protocols on May 29th, this Friday. So with that removal, it's eliminated. We'll speak to businesses that it's eliminated the your density in the stores or the restaurants. It's eliminated that. It's eliminated mask wearing indoors, and specifically for vaccinated people. And we'll speak to that more as we'll come back to that. But the masking is only needed in schools by children when they're indoors. When you're in medical facilities, and any public transportation requires masking. But when you start opening up these businesses, and we were just talking about how Memorial Day weekend looks with rain, you're going to have everybody indoors. And the virus is still around. So testing, and you've heard it multiple times here from the chief and the COVID team that testing is important. So this continues that, so we can continue to identify what's occurring in the sandwich community at that point. And then at the same time, and Chief, you can speak to this more also, is on June 15th, the governor's lifting the state of emergency. What does that mean?
So a couple things. When you lift a state of emergency, there are options that under emergency management that we can utilize. Some of it's staffing, some of it's equipment, some of it is relaxation on procurement, for needed supplies. So that's going to kind of fall by the wayside. And again, I know there's discussions about legislation to continue some of those items that were in the state of emergency. What it means for us is we just shut down the Emergency Operations Center virtual piece, which you've had up and running for 15 months. We've done 37 action plans since the beginning. Some were done weekly, then we went to bi-weekly. All that's tracked under the state of emergency for expense reimbursement, and so that will end. That on the 15th, we will go back to a more normal operation, though still keeping the command team together. It's just, it changes some things with procurement, supplies, and some of our staffing things that we can do, but we're also backed up by the American Rescue Plan, some CARES Act money, and FEMA. So it's a symbolic thing when you eliminate the state of emergency. There is some normalcy that comes back, which is good. But again, for us, it doesn't change a ton. It just changes some of the documentation that we've been.
So it's really the paperwork.
It's all paperwork.
Yeah. So one of the things, as far as that the general public will see, is when the state of emergency was put in place, the governor, working with the ABCC that oversees liquor licenses, allowed outdoor seating and serving of liquor. Right now, that you speak to some legislation. That's one of the things being considered as far as extending the outdoor seating, I think.
Correct.
So so at this point, you'll see outdoor seating at least until 60 days after the lifting of the state of emergency on June 15th, but would like to see those businesses be able to still go through the fall. I think it's highly advisable. I think there's a good percentage of people that would prefer still to eat outside than inside, even though they are eliminating the occupancy limits inside. The reduced occupancy limits that's being lifted. So hopefully that the state will and our legislators will work that out in order to provide it, because at the same time, if you drive around, these businesses put an awful lot of money in that outdoor seating.
Correct.
So a lot of money, and I can't see it hurting anybody. It's benefiting.
It's a driver for economic recovery. So when you look at a disaster and what are some of the economic recoveries that you can. This is low-hanging fruit, in my opinion. It's an extension, get them through the end of November, the ability to cost recover significant losses over the last 15 months. People enjoy it. It's safer.
Yep.
If you ask me as a fire prevention person way back in the day, hey, it keeps more people outside. I think it's a better option. And you're right, the investment was made under the auspices of support from the state and local people that we would support them. Why not continue it?
Right.
And I think that's, if you're looking for things that have been good that have come out of the pandemic, I think the flexibility for our restaurant owners to employ the outdoor seating, I think has been one of the better things. And I would advocate hard for that legislation to continue through November 29th at least.
So those who are listening or watching out there, one of the things you can do is call your state rep and advocate for that you want that for your community. Not even, all the restaurants that you may happen to visit, if you enjoy that type of setting. So you can make a call, send an email to your state rep and advocate for that. At this point, just one of the items too is that will be removed on May 29th, back before the governor implemented the state-mandated masking order. I think 2 weeks prior, meeting with our COVID team, I had put in place an emergency masking order for businesses and patrons. That will be removed on May 29th also. I think we're following suit with what the governor has done. We've followed their lead on the majority of items since last June, and we'll continue to do so.
Do we want to discuss town buildings?
Yes, let's talk about that. So I know that, again, we'll back up. I had mentioned about masking. The governor's removal requiring masking indoors is only for people who have been vaccinated. If you are unvaccinated, you are required to still wear a mask. You're not to be. No one's allowed to ask you if you've been vaccinated or not. But it's an honest system, really. But you want to speak to what we have going on with the town buildings, Chief?
Yep. So especially the annex, that's the one area that we look at. It's very busy starting now through July 1st. You'll see plexiglass will remain up. I don't think that's a bad idea at all. I think the social distancing markers will stay up. It's just people are almost trained at that point. So I see that as a positive, especially with the annex. You'll see hash markings outside, limiting the amount of people in there. I just ask that you be patient with that. But all the town buildings, you'll have that. You'll see that plexiglass, social distancing, the decontamination hygiene stations will be there moving forward. So I just ask people to be patient. And again, our town workers may be masked. They may choose to be masked. That's up to them. But again, just pay attention as you go into the buildings. It'll be posted on the doors, but that's the direction that we're, again, following suit with the recommendations from the governor.
Right, so the posting you'll see on the doors is basically what I just explained to you, that, a mask is not required if you're vaccinated, but is required if you're unvaccinated, but we will not ask. But at the same time, as far as the issue becomes, then it's like the scarlet letter. You're wearing a mask. And, really, I think as far as I'm vaccinated or unvaccinated, just with this whole situation as we progress through the summer with visitors coming, just be considerate of everybody, at this point, and be considerate to, what their other people's needs are with regards to this, and nothing should be forced on anyone. But just have an awareness that there's still some concern out there, and just be respectful of that.
Yeah, I think it's those that may have medical conditions. I think you'll see masking will remain in some aspect. I think especially in the winter months, those that have immunosuppressed issues may choose to wear a mask, not to be judged. And it's funny, I was reading an interesting article of everybody's asking those that are wearing a mask not to be judged. It's also on the flip side of people that, weren't wearing masks. And, there was a lot of back and forth. I just ask that people just be respectful. Yep. The good news is if you don't have to wear it, great.
Right.
And I don't care what anybody else does at that point. If they choose to do it, there's a reason for it. And,
well, I always, Colleen and I, my wife, just had this conversation this weekend because she's concerned. She's, immune compromised with some issues, and, what her feeling is. And she still wants to mask. And it's like, well, just mask, wear it if you're comfortable. Again, it's that whole old adage, don't judge someone because you don't know what they're going through.
Right.
So just be respectful of it.
I will say you will see our fire department members for congregate living, healthcare facilities. They will have masks on, and they probably will continue to wear them, at least for regular calls also. You'll see them on medical calls. It's a good practice to have. We're in a confined space in the back of that ambulance regardless. So you may see something along those lines. But, overall, it's going to be a transition. May 29th is going to hit. We're going to transition for a while, get back to some semblance of normalcy. But, again, those that require or need to wear the mask, feel free. Just worry about yourself.
Well, after this past year, Chief, we're tired. Everybody's had enough. But I'll tell you one thing: with wearing that mask, I didn't have a cold all year, so I didn't mind that at all. So.
No, I agree.
All right. Do we have anything else we want to cover here?
No, we've done pretty much graduation and proms coming up. That was on our list. And then, like I said, then July 1st hits. We do have the 4th of July parade.
Good topic. Do you want to outline some of that?
So it looks like 4 p.m. is the start time. I'm not sure if that's been officially confirmed, but because of Sunday and services, 4 p.m. There will be a limited fire department presence this year. Just 4 o'clock on the 4th of July is prime time for us in terms of responses. So it may be, we usually could get away with something in the morning before people got to the beach, but you will not see as big of a fire department presence as you have in the past. And I will say that for this year because I believe it's a Monday the following year, which is great. And we'll be past this and we'll have everybody back in the game then. But there will be a limited fire department response, but the parade will happen at 4 o'clock. Usual route through town. I know Chief Wack and Director Paul Tilton, DPW, working with Bud and the folks and the selectmen, to make this happen, traffic pattern-wise, et cetera. So some semblance of normalcy coming back. It is a different, start time, but at least that's happening. There'll be no fireworks this year, maybe in the fall. I'll let them decide when they're going to do that, but I know that, next year would be game on.
Well, let's, as far as July 4th, just so there's an understanding, it's taken months of planning, between Guy Boucher in the rec department and his staff and the town in general, and really going into this just 3 weeks ago, it was a determination of no parade, no fireworks a few months ago based on planning, and just 3 weeks ago, no parade at that point. But with the governor opening everything up, I think the town adapted to the situation and wants to provide that. It won't be to the scale that some people have used to, just because of the planning time frame. Yep. But it will be something for July 4th.
And it'll be nice to have. So
yes, without a doubt.
I think just prepping people that it may be slightly different this year because of a couple of factors, but, you know, it's happening. So I think that's the bottom line.
Yep, so we have not eliminated it, and it will go forward.
Yep.
So, all right, I think that probably covers
Covers
everything.
it for this week, excellent.
All right, so again, we're going every other week at this point. Going into the Memorial Day weekend, be safe. As we said, be respectful and be courteous of others, and we'll talk to you soon.
Thank you.